I want you to close your eyes for a second and imagine the most sophisticated manufacturing plant in human history.
Okay, I'm picturing it.
So it runs 24 hours a day, 7 days a week. It produces billions, and I mean literally billions of units every single day.
Right.
It has a logistics network that makes, Amazon look like a neighborhood lemonade stand, and a security detail that completely puts the Secret Service to shame.
And I I think the craziest part about all of this, the whole thing is hidden entirely inside your own skeleton.
Exactly. We are talking, of course, about the bone marrow. It really is the engine room of the human body.
Yeah.
But today, for this deep dive, we aren't just marveling at the machinery itself.
No, we're asking a much scarier question, actually. We're looking at what happens when that assembly line breaks down, specifically in children.
Yeah, it's a really high-stakes topic. Our mission today is to decode the why behind pediatric blood and immune disorders. We've got a massive stack of research here covering everything from pediatric hematology to immunology, all the way to oncology.
Right, which basically means we're looking at three massive interconnected systems. You've got the blood supply, the immune defense, and then the mutiny scenarios where cells go completely rogue, which we know is cancer.
Right. And we want to move past the dry medical textbook definitions today. We
Mhm.
really want to understand the mechanics, like why a toddler who drinks way too much milk might actually be starving their blood, or why you should never, ever touch a very specific type of childhood tummy tumor.
That last one is a literal life or death rule, by the way. But you're right, the theme of our sources here is mechanics. The human body is a machine, and when you understand how the gears turn, how a red blood cell is built, or how a platelet plugs a leak, the symptoms you see on the outside stop being random.
They become clues.
Exactly. They become very obvious clues to what's failing on the factory floor.
So let's put on our hard hats and walk right onto that factory floor. We're starting with a big word here, hematopoiesis.
It's a beautiful word for a very messy process. I mean, hematopoiesis is just the production line. It's the bone marrow churning out the workforce, which is your red blood cells, your white blood cells, and your platelets.
And the absolute star of the show, at least for this first section of our deep dive, is the red blood cell, the RBC.
The delivery trucks of the body, their entire job is a process called erythropoiesis, making these cells using a hormone called erythropoietin and, crucially, iron. They pick up oxygen from your lungs and they drive it to literally every tissue in your body.
But they don't last forever, right? The research points out they have a very specific expiration date.
They do. It's about 120 days.
Just 4 months.
Yeah, roughly 4 months. After that, they get worn out, their tires go bald, so to speak, and the spleen and the liver recycle them. That's the normal hemolysis cycle.
Okay.
But if the factory runs out of raw materials, specifically iron, you can't even build the trucks in the first place.
Which brings us to this really counterintuitive concept from the sources. Iron deficiency anemia. Now, I had to read this section a few times because it just didn't make sense to me at first. We always associate milk with health.
Right, strong bones, growth.
Exactly. Drink your milk. But the pediatric sources describe this phenomenon called the milk baby.
It is a massive paradox in pediatrics, honestly. You see these toddlers come into the clinic and they look chubby, pale, and seemingly really well fed. But if you actually look at their blood work, they're essentially starving.
Because the milk is what, empty calories for the blood?
Oh, it's much worse than empty. It's an active saboteur.
Only.
Yeah. First off, cow's milk has practically zero iron to begin with.
Saucy.
Second, the calcium in milk actively blocks the absorption of iron from other foods. So if you're, feeding your kid spinach to get their iron up, but washing it down with a big glass of milk,
The calcium just cancels it out.
it totally blocks it. You aren't getting that iron into the bloodstream.
That is a harsh double whammy.
And there is actually a third factor that really scares parents when they learn about it. Cow's milk protein can severely irritate the delicate lining of a baby's gut.
Oh, wow.
It causes this microscopic inflammation. So these milk babies can actually be losing tiny, invisible amounts of blood in their stool every day. They aren't just failing to take iron in, they are literally leaking blood because of the milk.
So if I'm a parent listening to this, aside from knowing my kid chugs milk all day, what am I physically seeing? What are the external clues?
You're looking for what the texts call the porcelain doll appearance.
Which sounds kind of cute, but I'm guessing it's really not.
It is definitely not a good thing. We're talking about skin that is exceptionally pale, almost translucent. But you'll also see their nails become brittle and spoon-shaped.
Spoon-shaped.
Yeah, they literally curve upwards like a little spoon. The child might also be incredibly irritable, just constantly fussy and grumpy. And physiologically, because they don't have enough of those red blood cell trucks to deliver oxygen, their engine has to rev higher just to keep the lights on.
Meaning their heart has to pump faster to compensate.
Precisely. You get tachycardia, a fast heart rate, even when the kid is just resting. And if you were to look at their blood under a microscope, the cells look tiny and pale.
Microcytic and hypochromic, I think the notes called it.
Exactly. They just don't have that rich red color because they literally lack the hemoglobin to carry the oxygen.
Okay, so the fix seems relatively obvious. You cut back on the excessive milk, push some leafy greens, and give them iron supplements. But the source material had a very practical, almost gross warning about giving liquid iron to kids.
Oh, the stain factor. Yeah, liquid iron is just nasty stuff. It tastes extremely metallic and awful, which makes it a nightmare to get a stubborn toddler to swallow it.
Right.
But more importantly, it stains absolutely everything it touches. If you give it to a child with a regular spoon, it can stain their teeth completely black.
Permanently.
Usually a dentist can buff it off eventually, but it looks terrible for a long time. And if they spit it out on their clothes, forget it. That's sure it's done.
So what's the pro tip for parents then? How do you get it in them?
Use a straw. Or, if they're too young for a straw, use a syringe or dropper and place it all the way back by the cheek, completely bypassing the teeth. And you should also expect their diapers to turn black too.
Good to know. Don't panic at the black diaper.
Right, that's actually a sign the iron is processing through the system.
Okay, so that's what happens when the factory is just missing some basic parts. But there's a much darker scenario outlined here. Aplastic anemia, this isn't just a supply chain issue. This sounds like a full-blown strike.
It's a total walkout. In aplastic anemia, the bone marrow just entirely shuts down. It stops making everything. No red cells, no white cells, no platelets. The medical term for it is pancytopenia.
That sounds absolutely terrifying. Is this a genetic thing?
It can be, but very often it's acquired. It might be an autoimmune reaction where the body suddenly decides to attack its own factory, or it can be triggered by chemotherapy or exposure to certain toxins like harsh insecticides or benzene.
And the stakes here, I mean, they have to be incredibly high.
Extremely high. Without the marrow factory running, you have zero immune system to fight off a simple cold and zero ability to clot your blood if you get a scratch. If left untreated, the mortality rate is staggering. It's around 70% within a single year.
Wow, 70%.
Yeah. But, and we always want to highlight, the good news from the research treatment is highly effective now. Bone marrow transplants or strong immunosuppressive therapy can basically jumpstart the factory or entirely replace the workforce. If we catch it and treat it, the 5-year survival rate shoots up to over 80%.
That is a massive turnaround.
Yeah.
Okay, let's move from the red blood cells over to the body's maintenance crew, the platelets. These are the little guys responsible for patching the leaks in the pipes.
Exactly. If you chop vegetables and cut your finger, platelets are your first responders. They rush to the scene, stick together, and form a plug. When a child doesn't have enough of them, we call it thrombocytopenia. In pediatrics, we most often see acquired thrombocytopenia, or ATP.
And the notes describe this as usually being a temporary glitch, right?
It is usually temporary. It's very often just a bizarre reaction to a routine viral infection. The body gets a little confused while fighting off a cold virus and accidentally starts destroying its own platelets. The count drops dangerously below 150,000.
And the immediate result of that is spontaneous bleeding.
Yes, but not necessarily like gushing horror movie wounds. You mostly see petechiae.
Describe those for us, because that's a specific look.
Imagine taking a fine-tipped red pen and making dozens of tiny pinprick dots all over a child's skin.
Okay.
It looks exactly like a rash at first glance, but if you press on it with your finger, it doesn't blanch, it doesn't turn white. Those are actually microscopic broken capillaries, leaking tiny amounts of blood right under the skin. You'll also see nosebleeds that just won't stop, or gums that bleed when they eat.
The no-go list in the sources for these kids was fascinating. It really felt like you essentially have to wrap the child in bubble wrap until their platelet count comes back up.
You basically do. The margin for error is absolutely zero. You cannot use a standard hard toothbrush. You have to use those soft little sponge swabs on sticks called tootheads.
To protect the gums.
Right. And no rectal temperatures ever. There's way too much risk of tearing that delicate tissue and causing an internal bleed. And absolutely no aspirin.
Because aspirin naturally thins the blood.
Exactly. You're already incredibly prone to bleeding. You don't want to make the blood even more slippery. And here's a big one for the medical staff. Absolutely no intramuscular injections.
No shots.
No deep muscle shots. If you stick a needle deep into a muscle, they will form a massive hematoma, a huge collection of blood inside that muscle, simply because they cannot plug the tiny puncture hole the needle made.
It makes complete sense. You're just trying to prevent any trauma that the body physically can't patch up. Now, speaking of clotting, we have to talk about the big one, the one everyone has heard of but maybe doesn't fully understand the mechanics of, hemophilia.
Ah, the royal disease. This is very different from just having low platelets. This is a fundamental problem with the clotting cascade itself.
Explain that cascade for us.
Think of normal blood clotting, like a complex row of dominoes. One falls, it hits the next, which hits the next, until finally, at the very end of the line, you get a solid, stable clot.
Oh, okay, I can picture that.
In hemophilia, usually hemophilia A, one of those dominoes is just entirely missing. Specifically, it's factor VIII. So you get a cut, you knock over the first domino, but the chain reaction stops halfway through. You never get the final clot.
And this is strictly genetic?
Yes, it's an X-linked recessive trait. So almost exclusively, it affects boys. Mothers are the carriers of the gene, and they pass it down to their sons.
The symptoms described in the deep dive sources sound genuinely excruciating. We aren't just talking about a paper cut that keeps dripping. We're talking about bleeding into the body.
Hemarthrosis, that's the classic hallmark of hemophilia. It's spontaneous bleeding deep into the joint spaces, the knees, the elbows, the ankles. Imagine the pressure of a water balloon slowly filling up inside your knee joint capsule.
Oh, that sounds incredibly painful.
It is agonizing. It causes severe swelling, limited range of motion, and if it happens repeatedly over time, that blood can actually destroy the joint entirely.
There was an interesting note in the research about when this actually gets diagnosed. You might not even know your newborn son has it right away.
That's what we call the crawler reveal. Think about a newborn. They don't experience much physical trauma. They just lie there in a crib.
Right, they're not doing much.
But the second that baby starts crawling or pulling themselves up to stand on the furniture, they fall. They bump their knees on the floor. A normal baby gets a tiny, barely visible bruise. A hemophiliac baby gets a massive, swollen, hard purple hematoma. Or when their first teeth start erupting through the gums, the bleeding just never stops. That's usually the exact moment that terrified parents rush them to the ER and we figure it out.
So the treatment is literally just replacing that missing domino.
Exactly. We give them 4V replacement of factor VIII, and again, strict injury prevention. These kids often wear padded helmets when they learn to walk. They have highly padded play areas, and they absolutely must wear medical alert bracelets.
Because in an emergency, time is critical.
Right. If they're in a car crash, the paramedics need to know the second they arrive that this child has zero ability to stop bleeding internally.
Okay, let's shift gears a bit. We've talked about missing ingredients like iron and missing instructions like factor VIII. Now let's look at a design flaw in the product itself, sickle cell disease.
This is a heavy, very complex topic. It's actually one of the most common genetic diseases on the planet. It's autosomal recessive, meaning both parents have to be carriers of the trait. If they both are, there's a 25% chance their child will have the active disease.
And it primarily affects specific demographics, right?
Yes, it primarily affects people of African, Mediterranean, and Middle Eastern descent. For context, about 1 in 13 African Americans are carriers of the sickle cell trait.
So mechanically, what is happening on the factory floor here? We talked earlier about those nice, round, red blood cells, the delivery trucks.
Right. Well, in sickle cell, the actual blueprint for the truck is wrong. Normal, healthy hemoglobin A is replaced by hemoglobin S. And when the oxygen level in the blood drops even a little bit, maybe from heavy exercise, stress, dehydration, or being at a high altitude, these cells physically change their shape.
Visualize that change for us.
Okay, picture a normal red blood cell like a regular donut without the hole. It's round, it's soft, and it's super squishy. It can easily squeeze through the tiniest microscopic capillaries in your body single file, kind of like a soft water balloon sliding smoothly through a narrow pipe.
Makes sense. So what does the sickle cell do?
Imagine that soft water balloon suddenly crystallizes into hard, jagged, sticky plastic, and it bends into a sharp C shape like a farmer's sickle or a crescent moon. That is a sickle cell. It doesn't squish. It gets completely stuck.
And once one gets stuck in a tiny pipe,
They all pile up right behind it. It's a massive logjam, a multi-car pileup on a single-lane dirt road. We call this a vaso-occlusive crisis.
and the consequence isn't just the traffic jam itself, it's what happens to the neighborhood down the road that isn't getting any deliveries.
Exactly. The tissue on the other side of that blockage is suddenly suffocating. It's getting zero oxygen. That causes severe ischemia, tissue death, and a level of pain that patients often describe as feeling like it's deep inside their bones. It is absolutely agonizing.
Now, the sources mentioned a really fascinating, honestly, kind of a mind-blowing detail regarding babies and sickle cell. If this is entirely genetic, why don't we see these horrible symptoms the minute the baby is born?
This is truly one of the most incredible quirks of human biology. We're all born with a temporary superpower called fetal hemoglobin.
Fetal hemoglobin.
Yeah, it's a special, highly aggressive type of hemoglobin designed specifically to steal oxygen away from the mother's blood while the baby's in the womb. But it has an amazing side effect.
Huh.
It physically prevents the sickling process from happening. It's a built-in natural shield.
So the baby is entirely protected by their own fetal blood for those first few months of life.
Correct. But right around 4 to 6 months old, the marrow factory switches its production over to adult hemoglobin. The fetal shield drops, and that's exactly when the pain crises and symptoms start showing up.
And the complications from those traffic jams are severe. We have the pain crisis, obviously, but the texts also detail something called acute chest syndrome.
That is actually the leading cause of death in these patients. It looks identical to pneumonia on the surface, fever, a bad cough, real trouble breathing, but it's actually thousands of sickle cells clogging the tiny blood vessels inside the lungs. It requires immediate, aggressive intervention.
And what happens to the spleen? You mentioned earlier the spleen is the recycling center for old cells.
The spleen gets incredibly overworked trying to filter out and destroy all these misshapen bad cells. Eventually, it can just get clogged with blood and enlarge massively, suddenly trapping a huge portion of the body's entire blood volume inside it.
That sounds fatal.
It can be. It's called splenic sequestration, and it can throw a child into hypovolemic shock very, very quickly.
It just sounds like a constant, exhausting battle to keep the blood flowing.
It is. The treatment mantra in the hospital is always hydration, oxygen, and pain management. You have to pump them full of IV fluids to dilute the blood and break up the logjam, flood their system with oxygen to reverse the sickling shape, and treat that bone-crushing pain very aggressively.
All right, let's zoom out from the internal blood issues to things that attack the system from the outside environment. Let's talk about lead poisoning.
This is just an environmental tragedy, largely because it is 100% preventable. We usually think of a kid eating peeling lead paint in houses built before 1978, but it can hide in old lead pipes, imported ceramic pottery, or even certain folk medicine remedies.
And the symptoms are really tricky to spot, aren't they? It's not like the kid starts glowing green.
No, it's highly insidious. It starts with a vague tummy ache, maybe some constipation, or they're just acting a little more tired or lethargic than usual. But while those physical symptoms are vague, the neurological damage is happening silently in the background. Lead specifically attacks the developing central nervous system
It damages the brain.
severely. It causes irreversible developmental delays, hyperactivity, impulsiveness, and learning disabilities down the road.
There was a connection in the notes between lead exposure and the iron anemia we talked about earlier that I had never realized. It's almost like a chemical case of mistaken identity.
That's a brilliant way to put it. Lead and iron are chemically very similar metals.
Yeah.
If a child is anemic, if they are iron deficient from, say, drinking too much milk, their body goes into a desperate scavenger mode. It opens the digestive absorption gates wide open, looking for any trace of iron it can find.
And if there happens to be lead dust in their environment,
The body mistakenly grabs that lead and absorbs it at a massive rate, thinking it's finally getting the iron it needs. So chronically anemic kids will absorb lead much faster and more efficiently than healthy kids. It's a molecular Trojan horse.
that is terrifying. So you obviously treat it with chelation therapy, giving them medications that bind to the lead to scrub it out in their urine, but you also have to fix the underlying anemia to close those absorption gates.
Precisely. You have to fix the iron deficiency, or they'll just keep absorbing more lead.
Let's briefly touch on a total immune system failure, HIV and AIDS in pediatrics. The notes highlight that the way this presents in kids is quite different from what we typically see in adults.
It is. In adults, we're usually looking for lifestyle transmission vectors. In young kids, it's almost always vertical transmission, meaning it passes from the mother to the child during pregnancy, during the birth process itself, or via breast milk. That's why HIV-positive mothers are strictly advised not to breastfeed.
And because a baby's immune system is still a work in progress, the virus just hits them incredibly hard.
It completely dismantles their T lymphocytes. As a clinician, you look for early signs that the defense system is offline. You'll see frequent oral thrush, that thick white fungal infection coating the mouth-swollen lymph nodes, chronically enlarged parotid glands in the cheeks, and generally just failure to thrive.
They just don't gain weight or grow.
Right. The absolute key to management is strict, unwavering adherence to antiretroviral medications to keep the viral load completely undetectable so their immune system can function.
Okay. We've covered the factory running out of supplies, the workers striking, and the genetic design flaws. Now we really have to talk about the mutiny, oncology, when the cells themselves become the enemy.
Right. You'll see the word neoplasm a lot. It just literally means new growth.
Mm-hmm.
We have benign ones, which are non-cancerous, and malignant ones. When those new malignant cells don't know when to stop dividing and growing, that's cancer.
Let's start with leukemia all in AML. This is cancer of the blood-forming organs themselves, and there is a major paradox here that I know confuses a lot of parents. You look at the lab results, and the white blood cell count, the body's immune soldiers, is absolutely sky high. You'd think, wow, my kid has a super immune system right now.
But it's the exact opposite reality. Those millions of white blood cells are what we call blasts. They are immature, half-baked cells. They take up massive amounts of space in the marrow, but they don't actually know how to fight a real infection. They're useless eaters.
So even with a massively high white blood cell count, the child is effectively completely defenseless.
Yes, they are profoundly neutropenic. They have no working defenses. And that is exactly why we have the strict no flowers rule in pediatric oncology wards.
Wait, no flowers? You can't bring a bouquet to a sick kid.
Never. Fresh flowers and potted plants carry invisible fungi, molds, and bacteria in the soil and the standing water. For a healthy person, it's nothing. For a kid with leukemia, breathing in a stray fungal spore from a daisy could be fatal.
That really brings home how fragile their system is. Now, there is a specific tumor mentioned in the deep dive sources that came with a massive, flashing neon warning label, the Wilms tumor.
The nephroblastoma. It's a very specific tumor that grows on the kidney. And the rule in pediatrics is simple, absolute, and drilled into every medical student. Do not palpate the abdomen.
See, that goes against every physical exam I've ever had or seen. The very first thing a doctor does is poke and press around your stomach to feel for unusual lumps. You're saying with a suspected Wilms tumor, doing that is actually dangerous.
It's catastrophic.
Right.
You have to treat this specific tumor like an unexploded bomb just sitting inside the belly.
That seems almost dramatic, though.
It's really not. This tumor is highly encapsulated, meaning it's contained inside a very thin, extremely fragile bubble of tissue. If a well-meaning nurse or a curious medical student feels a lump and gives it a firm squeeze just to see how big it is, pop.
Oh my God, and the cancer just spills.
Exactly. You instantly go from a neatly contained stage 1 cancer that is highly treatable with surgery to a stage 3 or 4 nightmare scenario where you have just sprayed millions of malignant cancer cells all over the inside of the abdominal cavity, all because someone touched it.
So if you ever walk into a room and see a sign over a crib that says, "Do not palpate," you keep your hands firmly in your pockets.
Hands in pockets, step away from the bed. You rely entirely on your ultrasound and your CT scans. Do not squeeze that belly.
Another really striking visual sign mentioned was for retinoblastoma, which is an eye cancer. This is one that parents sometimes actually catch themselves in holiday photographs.
Yes, the absence of the red reflex. You know how in older photos taken with a flash, you usually get that annoying red eye effect? That redness is actually a perfectly healthy reflection of the blood-rich retina at the back of the eyeball.
Right, we used to spend hours editing that out of photos.
Well, in retinoblastoma, the tumor grows right over the retina and blocks that red reflection. So instead of red, the flash bounces off the tumor and the pupil reflects pure white. It looks like a bizarre white glow inside the eye.
Leukocoria, the text called it.
Exactly. If you're looking through family photos and you see a distinct white glow in only one of your child's pupils, that is a major red flag that warrants an immediate trip to the eye doctor.
We also need to touch on an emergency that doesn't happen from the cancer itself, but happens during the treatment. Tumor lysis syndrome.
This is a wild concept to wrap your head around. It happens when your chemotherapy works too well and too fast.
How can it work too well? Isn't dead cancer the goal?
It is, but imagine you have a massive leukemia burden in a patient. Billions and billions of cancer cells. You hit them with a strong dose of chemo, and they all die at the exact same time. When the cell dies, it bursts open. It dumps all of its internal contents directly into the bloodstream.
And what's inside those cells?
A huge amount of potassium, phosphorus, and uric acid. It becomes a toxic soup. Suddenly, the blood is flooded with these electrolytes. The potassium spikes dangerously high, which can literally stop the heart. And all that uric acid forms crystals that instantly jam up the kidneys and cause renal failure.
So the chemo successfully kills the cancer, but the debris from the dead cancer turns around and tries to kill the patient.
Exactly. It's a massive medical emergency caused directly by the success of the treatment. We have to hyperhydrate the patient, flushing them with IV fluids to wash out the toxins before they can shut down the organs.
Medicine is just incredibly complicated.
It truly is. In oncology, we are constantly walking a razor-thin tightrope between curing the disease and managing the utter chaos that the cure creates in the body.
And sometimes the only way to actually fix the factory is to just completely demolish the whole building, the stem cell transplant.
The absolute nuclear option. For severe cases of sickle cell or relapsed leukemia that won't respond to normal chemo, we sometimes have to wipe the slate entirely clean. We use extremely high-dose chemo and radiation to intentionally kill the patient's bone marrow entirely. We shut the factory down permanently.
And then what? You just have an empty factory.
And we bring in the new workers. We infuse healthy stem cells, usually from a matched donor, into the blood. Those cells magically find their way inside the bones, they set up a brand new shop, and they start building a new, healthy factory from scratch. It's incredibly risky. The immune system is gone for weeks, but it's the closest thing we have to a true cure for these deep genetic errors.
We have covered a massive amount of ground today. We've gone from the bustling marrow factory floor, dealt with the milk baby paradox, navigated the agonizing traffic jams of sickle cell, and learned to back away from the unexploded bombs of a Wilms tumor.
It is a lot of heavy information to take in, but I think the main takeaway for you listening is to look for the patterns. The human body is always trying to tell a story. Knowing that a white pupil in a photograph isn't just a weird lighting glitch, or knowing that a fussy toddler who drinks a gallon of milk a day might actually be starving for iron.
Or knowing that beautiful porcelain skin isn't always a sign of a great complexion. It might just be a flashing factory warning light.
Exactly. These internal biological mechanics always manifest in ways we can see on the outside if we just know what to look for.
And here is a final thought to mull over before we go. We talked about fetal hemoglobin earlier, that amazing natural shield that completely protects babies from sickle cell symptoms for the first few months of their lives.
The fetal shield.
Right. It implies something incredible. The body already has a perfect working cure for sickle cell encoded right into its DNA. It just arbitrarily decides to turn it off after infancy.
That is the absolute bleeding edge of the medical frontier right now.
Because what if we didn't have to lose it? What if we could somehow trick the bone marrow factory into thinking it's still 5 months old and just keep producing that fetal shield forever?
That is exactly what brilliant researchers are working on right now, using advanced gene therapy to go into the DNA and flip that specific switch back on permanently. If they succeed, it changes everything. It's an incredibly hopeful future.
Definitely something to explore on your own. Thanks for taking this deep dive with us. Hopefully you'll look at your own bones with a little more respect today. There's a lot of heavy lifting happening in there right now.
Absolutely.
See you next time.